hero and to so many others. He's protected our war fighters, ensured that they were getting the proper care, fulfilling the dream and the promise that America has made to those who protect us 24 hours a day, 365 days a year. Let me tell you about Dr. Adam Robinson. He's had a great medical career. Many of you can find it on Google and other places. But what's important, he was the 36th Surgeon General of the United States Navy, which also has the Marines. He was the director of the Maryland VA system. Currently, he's joining us live as the director of the Hawaii and Pacific Islands VA system. Ladies and gentlemen, I present to you the brains, the leadership behind this new exciting series, Admiral Adam Robinson, Surgeon General. Sir, over to you.
Dr. Taborn, thank you very much. It's a true pleasure to be here, and I want to say to all the participants in the Women of Color Conference, thank you for being here. Thank you for joining us. We think this is a very important meeting and certainly very timely. COVID is a historic centennial challenge. Over 214,000 dead, over 7 million in the United States that are infected. Leadership is the cornerstone of moving beyond COVID. Organizations have lots of questions, as do our citizens. We question, what is COVID? How can we help to rid ourselves of it? Is a vaccine the way? And does vaccination need to occur in everyone in order to rid ourselves of it? Health policies affecting us. And today, I think we will get answers from a wonderful and a very distinguished panel, including Lieutenant General Scott Dingle, the Army Surgeon General. Lieutenant General Dingle, I just reverted to Navy time there, but I'm on Army time now. Lieutenant General Dingle, as Army Surgeon General and one of the nation's top physicians, what is your perspective of the COVID-19 pandemic era?
Admiral Robinson, it is indeed a pleasure to be here. First, let me say thank you. It's good to see you, Dr. Taborn, and all the distinguished guests, and of course, the women of color. It is truly an honor to be in this venue. I'm, as mentioned by Admiral Robinson, I'm Lieutenant General Scott Dingle. I'm the Army Surgeon General. I have the responsibility of overseeing 138,000 soldiers and civilians responsible for providing force, health protection, medical readiness, as well as medical countermeasures to the United States Army, as well as the beneficiary populations. I oversee all of the corps within Army Medicine, Medical Service Corps, Medical Corps, Dental Corps, Vet Corps, Specialty Corps, Army Nurse Corps, and we make up what we call the Army Medicine Enterprise of Excellence, which again, our mission in the Army is to deploy, fight, and win wars when called upon, but Army Medicine's mission is to conserve the fighting strength, which means we return them to duty, we keep our soldiers healthy, as well as our retirees and our beneficiary population. As COVID-19 has hit us, we find ourselves in a different perspective of providing support to forces. We're used to moving to what we say in the military, the sounds of the gun. It means that when the fire and the battle goes off, the Army's going and to take the hill and to defeat the enemy. This time with COVID-19, we find ourselves fighting a different enemy. This one is not one that's physical that we could see, but it was one also that was not just impacting soldiers as it hit us in Korea early last year before it came to the States, but it started hitting our citizens in the United States. And so as we move to the sounds of the gun of this silent enemy, this COVID, this pandemic, we find ourselves in Army medicine as part of what we call the whole of government approach. The whole of government approach means that we put all of our assets together in our nation to fight this pandemic. So I am the Department of the Army's, top medical professional who provides that support to the Department of Defense as we integrate with the whole of government approach to find the medical countermeasures, the vaccine, the prophylaxis, the preventive methods in order to defeat this COVID-19 environment. Operation Warp Speed was presented yesterday by General Gus Perna. I hope he had an opportunity to see what we're doing. Our role in the Army has always been to assist our government to sustain the lives of not just our military personnel, but our civilians. As we do that, we've always partnered with medical research, with industry, with academia, but most importantly with Health and Human Services, who is the integrator of all of our capabilities in our nation in order to defeat this pandemic.
General Dingle, thank you very much. That was very timely and it was very on point. In addition to General Dingle, our panel also includes Denise Pines. Denise, Ms. Pines, as a global health leader in your own right, could you help explain two things? A little bit about who you are and also about what you think the global health leadership challenges are in the age of COVID. Over to you, Ms. Pines. Ms. Pines, I want you to mute. You need to unmute.
About that. I'm the president of the Medical Board of California. I'm in my third term of my presidency. So what we do is, so in my capacity, we oversee the consumers of our state and to protect them. And we do that by licensing the best doctors and by regulating those doctors once we license them. So in terms of, what this pandemic has meant to us is making sure that the front line, which are our doctors and other allied healthcare professionals, are not encumbered and are able to perform their job to the best of their ability. And so not have a lot of regulatory red tape which is what our department does, impact those doctors, and so that they can operate and function freely without having to think about regulatory process along the way in terms of trying to save lives. So that's what we did in our state.
A couple seconds later then said during, How significant was it that the defendant in this case actually said
Excuse me. Thank you, Ms. Pines. That was very good. And the third member of our panel this morning, a supply chain professional and expert, is Deepa. Deepa, what do you think are some key leadership challenges in the age of COVID? And also talk a little bit about who you are.
Sure. Thank you so much for this opportunity. I'm really honored to be here. So a little bit about myself. My name is Deepa, and I am the Director of Global Supply Chain and Planning for Boston Scientific. When COVID came by, it was obviously a change for everyone, and a big change, especially supply chain came up front in everything. Boston, being a part of Boston Scientific, it's a global company. We have 20 manufacturing locations, and we have people from different diversities, different backgrounds all around the world. So as COVID hit us, the first and foremost thing that we did as a company was to think about the people. Are people safe? Do they have everything that they need to work from home? We realized as we went through this that we were better positioned to do that than we actually thought. So our employees seamlessly transitioned to a work from home setup. Now, as we did that, manufacturing facilities could not work from home. So obviously, we had to find ways to ensure their safety. We had to think about our customers. As well, we had to think about how our business is going to perform. So one of the several things that we did as we were going through this crisis is we have an excellent team in supply chain, some of the best minds working together, and we have this Center of Excellence team, which started looking into the different trends of the demand on how it's going to change and how it's going to impact our business. So we put together different models and different scenarios to see once the demand starts coming back up, how are we going to be able to plan for that, and how are we going to be able to best support our customers as the demand starts coming up. With all the different modeling and scenarios that we did, and we tailored it to each business. Boston Scientific has several businesses that we support, so we tailored it to each business. And I am very proud to say that we are still in the crisis and we are still learning, but at the same time, we were able to take care of our employees with zero layoffs. We were able to take care of our customers with minimum disruption, and we were also able to take care of our business performance, whether it's bottom line revenue or just the overall service levels that we were providing to our customers. Again, we are learning. There's a lot more to go, but I'm sure there's going to be a lot of best practices that we can share after this.
Deepa, thank you very much. I think you emphasized something that all of us can agree with, and that is we're all learning, because this is truly a new phenomenon, and it's teaching us a lot. Some things we don't want to learn as much as others, but it's certainly a teacher. With that, let's have a series of questions. General Dingle, who, in your opinion, are the key leadership groups and organizations needed in order to respond effectively to a pandemic?
Adam Robinson, key leadership groups and people required to effectively respond to a pandemic. I believe it starts with the Secretary of Health and Human Services. The Secretary of Health and Human Services, he leads the federal effort in response to every pandemic and all medical and health emergencies in our country. So in essence, they're the synchronizer and integrator for pandemic and disaster response. They do this under what's called Emergency Support Function 8, which is Public Health and Medical Services, and they coordinate the national support to every local, city, town, and state government. A lot of folks, when it comes to the military, from our perspective, as you know, they believe that, well, where's the military at? How come they're not in here in responding to this pandemic or this emergency? Well, through the Emergency Support Function 8, there is a process through the local town government responders who send a request up through the state and the governor to the Department of Defense, and then we come in. But it is all synchronized by, again, the Secretary of Health and Human Services. The Secretary is Secretary Azar. He has 11 operating divisions and 8 agencies, to include the Public Health Service and 3 human service agencies that he has at his response. In addition to that, he has 10 regional offices that cover down on all of the states within our nation to help the responding to a pandemic in this case. One of the key branches is under the Health and Human Services is the Assistant Secretary for Preparedness and Response, which is led by Dr. Bob Cadlick, a tremendous friend and servant to our nation. He synchronizes the effort between CDC, WHO, and all of our National Department of Defense, as well as government organizations. So the Public Health Services is one of those entities that he also helps synchronize. The Public Health Service is led by Admiral Giroux. He's a 4-star military health system leader who is really the top medical person, in our nation. Underneath him, he has a principal deputy who is a woman of color, Rear Admiral Sylvia Trent Adams. And then at one of his deputies, or rather the U.S. Surgeon General, is Vice Admiral Jerome Adams, and his Deputy Surgeon General is Rear Admiral Erica Schwartz, another woman of color. And so as you can see, our organization, under the Department of Defense, as well as our federal government, is all synchronized under Health and Human Services. They have the responsibility of also synchronizing all of the government departments and agencies, whether Department of Agriculture, FDA, Commerce, Energy, Homeland Security, Interior, EPA, all of them. They are those synchronizers. The Department of Defense, we bring to the table the Army, the Navy, and the Air Force. I am the Army Surgeon General. We have an Air Force Surgeon General, Lieutenant General Hobb, and a Navy Surgeon General, Rear Admiral Gillingham. We represent the services and we provide that support as we respond and synchronize our response to the pandemic. And then, of course, in addition to those key personnel in agencies and departments, we also have the private industry, the medical research, development, and production industries, academia, and of course, synchronizing with the World Health Organization. Together in our country, that's what we call the whole of government approach. And again, this black swan event, this rare occurrence of this pandemic of this nature and magnitude, what you see happening is a synergizing of each of those elements in order to find the medical countermeasures to save our citizens as well as the people of this great nation.
General Dingle, that was a tremendous expose that you just delivered regarding this, and I do appreciate it, and I hope everyone appreciates as much as I do. As we go through this whole of government approach, and as we go through all of the agencies and the personnel from the top of the government down, how do the key members share information, disseminate knowledge, and ensure that the research raised is based upon information and accessible to personnel in the military health system and DoD? In other words, how do those leaders actually help people believe what they're doing, what they're saying, and that it is based upon research and not anything else? Go for it.
Well, there is a process, and there are the experts, that we do leverage in each of the areas. CDC is, again, the center of gravity, but it is all, again, synchronized through a joint information and intelligence center that pushes out the information. Even from Health and Human Services perspective, and the CDC is executing and providing us the guidelines and the countermeasures and the preventive measures. We use that as our authority within our nation, the Center for Disease Control, as the synchronizer. And again, the Assistant Secretary for Prepared and Response, Dr. Cadlet, he is a synchronizer of that information as he leverages the CDC. Now, each of the agencies that I mentioned in those departments, we then must leverage through our secretariats, that's our civilian leadership, as well as our services, the uniform, the operational side. We must push that information out through staff and command channels from authoritative sources, CDC, Health and Human Services, over to the Department of Defense, then down to the Department of the Services, as well as the government civilians. But also the information is also going out to the public because it is all synchronized in a whole of government information push. And then so through the public affairs, social media, public service announcements through the U.S. or the Public Health Surgeon General, Jerome Adams, Admiral Giroux, or any authoritative medical professionals. Again, the CDC is the reigning and lead agency that helps us establish what our medical countermeasures are. Once we start getting outside those lanes, those are not the entity or the sources that we should be referencing or listening to. It is a collective and a synchronized effort that we're pushing this information out to include within the Army Public Health Center. We have a very robust capability that deals with the force health protection of our civilians, our DoD beneficiaries, but it applies to our civilians in our country. And so you will also see information, education and awareness information coming out from the Department of Defense that also goes up through the Health and Human Services over to the CDC as what we call a combat multiplier or a facilitator of authoritative approved medical research information because we do things through FDA and through emergency use authorizations, which there's a process to make sure that we are doing it right. And we push that information out through those channels.
Again, a tremendous answer. You do bring up one point, and I must ask it, and that is, how does politics affect the ability of all of the whole of government to do its job, and then have the people understand and believe?
Well, again, as you know, after serving many years, that, the military, we are apolitical, so we don't get involved with the politics. And so the information that we push, comes from those channels, those aforementioned channels and authorities that we basically follow the guidelines from. Anything that comes from a political perspective, we don't endorse because we follow, again, a pragmatic and a deliberate source of our information for our medical research and our development. And we provide those up through the Department of Defense. And again, we don't push it out on ourselves, but again, we synchronize it back through the CDC and Health and Human Services, ensuring that we are all nested. When politics come into play, well, we don't advise our soldiers and civilians or endorse any political positions, but we stay within our lines of responsibility and effort, following, again, the authoritative research entities and agencies.
I really like that last part, and that is to follow the authoritative research enterprises and information. So thank you very much. I appreciate that. Ms. Pines, how do you think we can build and maintain trust between leadership and our people? In your role between leadership and the staff that you oversee as president of the California Medical Board, but also the information that you must get out to the public so that they will trust you and understand what you're doing?
So I can only speak definitely from the medical board's perspective on this question. And so what we did and what happened with us is that our board was considered essential critical infrastructure workers to perform essential government functions under our governor's executive health orders. So in order to protect the public's health and lower the risk for COVID-19 transmission, the health and safety and well-being of our employees was first and foremost, right? Especially now that we were considered to be the essential workers. And so not all of our staff had the luxury of being able to work from home. There were telework options. We also issued staggered work shifts, so there weren't people working at the same time in order to provide the physical distancing protocols. We closed the public access to the board's buildings. We had frequently cleaning high contact areas. We supplied, of course, our staff with masks and gloves and hand sanitizers. And we began frequently educating our staff on a regular basis, starting with our managers first, to work with each group. We have about 200 employees for the medical board. And then those are just some of the preventive practices that we did, but we also recognized that the staff they were having, sort of what I would call coping challenges. All of us, I'm sure, have had a moment during this COVID crisis of one sort of another, even if it's simply you couldn't go on vacation this year, and what usually that might mean for you. And so we've scheduled regular Zoom meetings with licensed therapists for our staff to help them manage the stress. We continue to talk with those who are still teleworking to see if they still want to continue to telework. We are not pressuring any of the employees to return back physically to work. And there are some who want to return to work, but we have still require that a particular position still work at home. So that's really tough because A lot of the work that we do is highly confidential. A lot of the documents that we have are highly confidential. So of course, those cannot go to anyone's work environment. So some of those employees that are still mandated to work from home have to physically, at least once a week, come into the office to gather that data. And when staff members, and we have had staff members test positive in the workplace, we intervene, quickly, and we work with the public health authorities to make sure that we're halting the spread of that virus. And we put a plan of action together, and we communicate what that plan of action is to all the employees. And we continue to purchase more items. We have now clear partitions because a lot of the employees work in cubicle environments. And so since we oversee the critical and essential healthcare workers, which are the doctors, we've worked with a variety of government agencies, including Department of Public Health, to make sure that even to our doctors, we are disseminating information that's critical that they need on a regular and constant basis, and making sure that our website is constantly updated with all of that new data. We don't want them worrying about things like license renewals at this time. We don't want them worrying about particular regulatory issues that center around telehealth. In our state, we had very strict telehealth regulations, and we've waived a lot of those. And we are looking, actually, the Federation of all medical boards have been gathering to talk about what does telehealth look like moving forward in our country, and what will that look like from a regulatory process. But we want to make sure that our doctors, our licensees, are able to operate without any risk of penalty. So that's sort of how we've worked with staff, and then how we've worked with our licensees.
Thank you very much. That's very comprehensive. What methods of communication do you think are the most effective between leadership and staff? Because you have a variety of different portfolios that you have to take care of, a large staff, COVID-19. What's your method of communication? What do you think is the best one that you're utilizing now?
Really, it's email, because that gets to every single person individually. And so that has been what we've used the most. Of course, Zoom calls, gathering people every day, having a regular meeting in the morning, a wrap-up meeting by the end of the day. We've consistently done that. Our governor has also done that from day one. He's had a standing, consistent, even over the weekend, public interface that's on his Facebook, Twitter, and of course broadcast by local television. So I think constant communication is really, really important, because we're getting so much information, because every day something changes. Every day something new, every day we're learning more about the virus. And we're also getting misinformation. So I think it's important that people know that there's entities that are going to consistently provide the correct information, and that you can go to those entities to get that information. I think that's really important during this time. The Admiral's talking about talking about the CDC being the center of where the information is coming from. And I agree with that. If you have too many sources of information, people get confused, and they will start to believe things that they shouldn't believe.
Thank you very much. Deepa, the COVID-19 pandemic is having a long-term impact on the economy and on jobs. What does the new normal look like, in your opinion? That's number one. And then the second part, what new skills would we need to develop quickly in order to mitigate the pandemic? Go ahead.
Thank you so much. What happens to the very long-term economy? I think we'll all find out. I do think different sectors are going to be impacted in different ways. As far as the medical device sector goes, in Boston Scientific, we saw a very strong recovery. In fact, in many divisions, we saw a V-curve recovery. This pandemic is a new phenomenon to everyone. So I really think that something that that's going to change is this, doing things virtually, having the tools to do everything virtually. As the pandemic, was going on, we were able to very successfully launch a new product in Europe. All this was done, via Zoom calls, and we got feedback from the customers via Zoom calls. It is possible. Again, it's a new phenomenon. Everyone is learning. People used to travel everywhere, get on the next flight to do all these different meetings, but now all this is happening virtually. So it is possible. I'm sure there's going to be new tools that's going to be deployed as we move forward. Something when you talk about a new skill, one of the new skills that we really need to develop, and I think we all have it, but we need to develop more, is how are we going to work in this virtual environment? Doing business without a handshake, if I could say, that's going to be new. I'm sure that it's going to be easier for some of the newer generation. When I talk about the Gen Zs, they were born with the phone, so probably it's going to be easier for them. But for people like us who always traveled, who liked the human interaction, that's something we should be, that's something that we have to absolutely adapt. EQ is going to be very important, emotional quotient. I mean, going forward, working virtually is not only going to be accepted, but also expected. So I think these are some of the things that we have to adapt to and learn very quickly in order to be successful in any company.
It's a very interesting comment. Working virtually will not only be accepted, but it will be expected. I'm thinking of telehealth that Ms. Pines just brought up in terms of some issues with healthcare, and that certainly is the case. What do you think, Deepa? What do you think we need to be prepared for in terms of, or we need to learn in terms of being prepared for the next pandemic? And I really like what you've said thus far, but is there anything else you can? And I'm thinking more from a supply chain, from that business aspect of bringing people together, but yet we're keeping them separate. So go ahead.
Coming from a supply chain background, we are very process-oriented, very data-driven. We have a process for everything. We map out a process for everything, and we establish standards. So I am pretty sure, I'll give you a few examples. Like I mentioned, safety, putting people first and putting safety first is one of the core values for Boston Scientific. And we made sure that before we brought people back into the office, we had them prepared. So we deployed several e-learning courses, which they had to take before they got into the office, so that they understand, how they need to be prepared, wearing masks. The regular PPE, wearing masks and gloves and temperature checks became the new normal. So benchmarking is going to be very important. I know there's a lot of research firms that bring different businesses together. So benchmarking the best practices from different businesses and adapting it as we go is going to be key. There's business continuity planning for tornadoes. There's business continuity planning for hurricanes. pretty sure we're going to come up with a business continuity planning for a pandemic. It's not written out yet, but I don't see any other way to do this so that we are prepared. Sure, this is the first of its kind in the modern era, but there has been pandemics before, and I'm sure there is going to be in the future too. So in order to be prepared for that, we have to establish standards. And the only way we can do that is by benchmarking and sharing best practices across the businesses.
Thank you very much, Deepa. Ms. Pines, these are questions now coming from our audience. And I'd like to ask, and one question is asking you, what advice do you have for women of color who are becoming physicians?
Ooh. We need you. Let me start there. So I see the data. I'm sure you guys also get the data of how many African Americans are actually going into medical school. So I see the data for the state of California. I sit on a admissions committee for a medical school, and it's dismal, to say the least. So what that is saying is that the percentages, which are around 2 to 4%, those are our future doctors, which means we are not having future doctors that are looking like us. And so my thought is make sure that we need you. We need you to be in this profession. We need you to be out publicly speaking anytime that you have a chance, so that more and more young people can see doctors that look like them and see the potential that they can become a doctor. It's really, really important. The size of our population means that we are not having doctors who really understand culturally the community that is being served. And that is one of the reasons that we see the disproportionate COVID impact. If we had more doctors of color, more Latino doctors, more African-American doctors, I don't think that we would see this disparity that we are having right now with the coronavirus within these communities, if we had more doctors of color. So I encourage you to, you can feel free to reach out to me to get any support, to get connected in any way that you might need to be connected, to get the resources to support you. As a woman in this space, the medical profession is very still male dominant. And a lot of women face, what we find is women get burned out more in this space, and women doctors commit, they have higher rates of suicide. And we have been trying to understand this a little bit more. And one of the things that we know is that women still have to take care of the household. So I may be this great surgeon, but I still have to go home and make sure the kids have their lunch and coordinate all of that sort of stuff. That still falls into their purview. So there's that additional amount of stress that they have. But also inside the work environment, they have a unique kind of stress that nobody really talks about. And it can be simply this. I'm a surgeon, I make an error, perhaps I lose a patient. My male colleague makes an error just like I did, and he loses a patient, and it's on his side, it's considered to be an error. But when I make that error, I'm considered to be stupid and an idiot. And that is what is prevalent a lot in the work environment for physicians, for women. And we need to uncover that, and we need to address that across the country that women are dealing with. That's an extra burden, and that I believe is leading to that higher rate of suicide.
Thank you very much, Ms. Pines. General Dingle, this question is for you. Which leadership models do we already have in place to guide innovation and pandemic response, and which models are we currently designing?
Which leadership models do we currently have in place in reference to the pandemic, and which are we, what was the second part?
Well, it says which leadership models do we already have in place, and this is to guide innovation in pandemic response, to guide innovation in pandemic response. So if you take all of the whole of government model and all the pieces, how are we, how are our leaders and how are they guided in innovation? And what models are we now working on? Because now we're being informed by the pandemic. So now we can make different decisions because, for example, telework was not thought to be really a viable alternative. Now everyone's teleworking. As a matter of fact, in a sense, we're teleworking right here. Go ahead.
So I would say, starting working backwards with the telework piece, telework has been one of those initiatives that we have been trying to implement and get off strongly within the military health system. The civilian sector is way ahead of the Department of Defense when it comes to virtual health, telemedicine. In the pandemic for us in the Army Department of Defense, that was one of the models in which we were trying to get going. Again, the industry, academia, is always collaboratively partnered with the government. And so a lot of the leadership models or efforts that are in the medicine enterprise, we basically will try to embrace those best practices within the Department of Defense. In the case of telemedicine and telehealth and behavioral virtual health, we increased 104% in the United States Army alone. Well, we couldn't do it until the pandemic. You were absolutely correct. The pandemic raised that concern about the spread of disease, so people were not coming into our medical treatment facilities. And then when they started to tie into our virtual platforms at an astronomical rate that, it's been difficult for us to keep up as we now spend more monies to improve our platforms for virtual health and behavioral health via these venues. So those we are implementing, those are guiding us, especially in the pandemic. We've now opened up in the Department of Defense all of our services in our medical treatment facilities. However, what we're experiencing is that the beneficiaries and the soldiers, sailors, airmen, Marines do not want to come to the hospitals. They'd rather do the virtual appointments. And so in conjunction with our Defense Health Agency, we are working with trying to accommodate this new normal. And so the adaptive leadership models, what I would say when it comes to the innovations that are happening within medicine is what we are doing. We are a learning organization. And so for those best practices, whether if it's treatment, protection, prevention, the medical countermeasures, we are all synchronized and learning together. And then we adapt an adaptive leadership style to what's best approved through authoritative agencies, CDC, FDA, and EUAs through proper channels. We adapt to those new things as we're learning from COVID. And then I'll mention also for the managers, the leadership, us, we have to make sure that we are leading our organizations at every level, to meet the problem, to ensure that the preventive measures are in place, the right ones, not the political ones. And so leaders must, one, understand, communicate the visions, the leadership style, whether adaptive, and ensuring that the objectives of your organizations are met. And then as managers, we provide that guidance to the organization, but we also are looking for the issues that arise too, and ensure we are attacking those issues and solving those. And that is a constant do loop. And in order for us to do that, we're plugging back into, again, the medical research of industry, academia, and all the latest technological innovative ideas and medical countermeasures. And we, through our Medical Research and Development Command, we implement those adaptive leadership styles to make sure that we're providing the best medical care, to our soldiers and our beneficiary populations. But as leaders, again, it's our job to make sure that we're attacking, addressing, and connected to our organizations down internally, but also externally up and out, and ensuring that we're solving those problems. And communication, as was mentioned earlier, is a key piece. Knowledge, we call it knowledge management. Ensuring that the knowledge and information, the right information knowledge as leaders and managers is pushed down as well as pushed up and out to those who benefit from it.
Thank you very much, General Dingle. Deepa, how does Boston Scientific promote diversity that can attract women of color for leadership roles?
I really love this question. The very fact that I'm here shows how much Boston Scientific values diversity in women and just inclusion overall. only way to promote this and make it attractive is being intentional about it. And we are very intentional about it. Talking about unconscious bias, making sure that we are driving the message out to the population around Boston Scientific, using social media. Whenever there is a job posting, making sure that you have equal number of men and women applications, which is one thing that I also did when I was hiring. If I had 2 male resumes, engineers, I pushed to ask for 2 women. Really being intentional, going after it is what matters. Also associating yourself with, there are several organizations. One of them is the SWE, Society of Women Engineers. Really associating yourself with them, partnering with them, you can come across a lot of great women talent with engineering background. We have employee resource groups, women employee resource groups, where we get together and talk about it. And also having metrics, right? Again, I go back to this, but if we have a metric for success, and if we say we have to be at 50%, not only building the pipeline, but also at a leadership level, and communicating it back to the society, saying this is what we want to achieve in Boston Scientific, and we do all that, is going to attract more great women into the organization. And there are several great leaders who are doing that. And like I said, just I am here is a great example of what Boston Scientific is doing.
Thank you, Deepa. I was listening to your answer and actually thinking about it and forgot to unmute. This is for any of the panelists. How can we integrate women community members, such as Native American tribal leaders, multilingual groups, and non-allopathic practitioners into public health and STEM right now? I'm opening it up to everyone, but if no one answers, I'll pick someone, General Dingle.
I think he was going to have me go last since I'm the mayor.
It's a different question, but I think, just so everyone, this is for the group. This is a question that is really saying, how do we become, how does diversity work? How can we actually put diversity in action and then take even more marginalized groups? Why do I say more marginalized? I don't ever think of tribal leaders personally. I don't ever think of some of the multilingual groups or the non-allopathic practitioners, actually. Now, so I'll leave it there. I'm not going to give a treatise on this, but go for it.
So I'll start and I'll hand it off to my distinguished panel teammates. In the Army, as you may have seen in the press, we've had a lot of diversity issues, not just with African American and men and women of African American descent, but of all colors. And so what we're doing, it is a deliberate effort. And in order to get more from those tribal and for those other lower representative ethnic groups, it takes a deliberate effort. It cannot just be a bumper sticker, but every leaders have to look at their staffs, look at their organization diversity makeup, and then we have to make sure it is a deliberate recruitment, a deliberate mentorship, a deliberate education awareness of the opportunities in the profession, and we have to take it to those communities and not just go into the big giant oceans and fishings, getting what we've always got when it comes to the makeup of our staffs and of the profession. So we got to go to those small ponds and to those small areas and to those little ethnic groups and reach out to them and give them the hope and the inspiration. Just looking at the panel itself, as I see the women of color on here, wow, we have to take that and let others see it. But yet we, the leaders, also have responsibility of not just having reached that plateau, but we got to leave the plateau and go down to the valley and into that small area and inspire them to come in. But at the end of the day, it comes to the decisions and how we make up our staffs, organizations, our recruitment, and our efforts. We can bring the change, but it has to be deliberate. We call it, deeds, not words. We can't just talk about it. We got to show the actions behind it by actively recruiting them into the profession. And we call that project inclusion in the Army. We're just kicking this off this year. It's not anything new, but now it's being deliberate. It's being held to the standard, because now we're addressing those unconscious and conscious biases that are keeping those small ethnic groups of color out of our teams and staff.
Yeah,
I would love.
Oh, sorry.
Go ahead, Denise. Go ahead.
Yeah, I was going to say that I totally agree that it has to be intentional. And then you have to, when you decide that it's going to be intentional, you have to go beyond what you've done. Because if you're looking at what you've done over here to recruit, that is not going to work. So I'll just sort of talk a little bit about the medical school that I'm a part of. We are intentional in that we have reached out to schools that we know have particular populations. So large African American population, large Latino population, and populations with Native Americans. And intentionally worked with the curriculum that they have to create a pipeline that we can make to come to our medical school and support that financially in the ways that we know we need to support that. So whatever that may be, in order to create that pipeline, and then to look at giving preference to those young people as a first look at our school and consider them, and to also, I won't say lower the bar of, say, an MCAT score or a GPA, but to recognize that there is bias in the MCAT and in the GPA, depending on, you could have had a racist professor who gave you a lower score than you really should have gotten. And so we will look at someone with a different score than what a normal score would be and consider all of that person, including their intent to be why they want to be a doctor, their letters of recommendation. So you've got to be intentional, and you've got to put the intentionality pieces in place, and they cannot look like the way they look over here. If you bring that mindset over to saying, oh, I'm going to recruit more Blacks or more Latinos or more Native American, but you take this standard approach to it, it is not going to work.
I just want to finish by saying that, I came to this, I was not born here. I came to this country from India. I came here to get my master's. So I had nobody I knew in this country. English was not necessarily my problem, but really just to work, being in a different country, working my way around, everything was new. I agree with what everyone said about being deliberate about it, being intentional about it, removing the unconscious bias. I just want to round it up by saying that, there were a lot of great people, great leaders, great mentors who helped me, who pulled me up and pushed me forward. So if they were not there, I don't think I could have ever imagined or dreamt of being anywhere in an unknown country. I had the education and I had the talent. It took me the right people all along to show me the direction. And now I strongly feel that I need to pay it forward. Not only for women, but everyone, who are of different diversities, coming from different countries. Some may not really necessarily know the language very well. And Denny said something about it very well, and I would like to add to that it's not that we should pick the wrong talent, but we should give them an opportunity, because a score doesn't say everything. A resume may not say everything. So giving that chance and being intentional about it is very, very important. And
Thank
I'd like to
you.
thank all my mentors so far who have helped me in this journey.
Thank you, Deepa. And thanks to all the panelists. That was really a terrific answer. And I just want to underscore the intentionality, the fact that, and I want to underscore this, numbers may mean a lot, but they don't necessarily tell you who that person is. As a matter of fact, I'm going to go so far as to say they don't tell you. General Dingle, how do federal, state, and local government come together in times of public health crisis in an effective way? And I'm thinking in terms of the COVID response, but how do we bring them together and keep them together so that we can have a coordinated response that reaches the grassroots of the country?
Leadership. Leadership. I think not unprecedented, because we've had to some measures of success in the past where we have come together, but yet even as we have come together in the past, it was always like a lumpy soup. You know, the department or agency or academia or industry or private sector may have still had walls up protecting their best practices, you know, because of whatever. What we've learned here is we have a synergy that has been established, and lessons learned that are inculcated that have made a difference. And I think we have to apply the lessons learned that when everybody comes to the table under synergy, but there's also been leadership. The Health and Human Services has grown tremendously. And Asper and Dr. Cadlick, Preparedness and Response, have done a tremendous job trying to synchronize and put their arms around this tornado. It is extremely difficult bringing it all together. In order for us to move forward and to continue to do this, we all cannot go back to our foxholes or to our caves and dig back in the ground for their own private gain. But we must continue as leaders to bring together each other's agencies and represent us to solve the problems, whether it's a pandemic, a hurricane, a tornado, or anything that impacts our nation and our citizens of the public health. Over.
Thank you, General Dingle. Deepa, I have a question for you, and it's a little different, but the question is, as a biomedical engineering student, what advice would you give to ensure that we thrive as we re-enter the industry post-COVID?
And that's what I'm doing today. Healthcare is personal. To Kimberly, Dean.
Actually, I don't have a biomedical degree. I have an industrial engineering degree. But can you repeat the question again? Sorry.
Yes, and that's why I said it was a little different. But
yes,
this is addressed to you as a biomedical engineering student. What advice would you give to ensure that we thrive as we enter as we enter the industry post COVID-19? And I think forget the biomedical. Just think of a healthcare engineering and go from there.
There's going to be a lot of innovation, I'm pretty sure, in the medical device company. I think keep your eyes open. There's a lot of learning that's going to come out of this whole pandemic. I think we are all learning. We already saw a lot of. I know telehealth and telework was there. It existed, but it came forward in a much bigger way than we ever thought. If we thought we are going towards a digital footprint, I think this pandemic just accelerated that whole being digital. So I think digital is going to be way ahead. I also think keep your eyes on artificial intelligence. That's the next big thing that's going to happen. And I am sure that it's going to come faster than we ever imagined. So just the technology and the artificial intelligence piece is going to be key.
Thank you very much. Ms. Pines, this question's to you, and that is, what can we do to ensure that all health professionals, students, and practitioners have required training in epidemiology, public health, and infectious disease crisis response.
Ooh, that's going to require medical schools to include that training in their curriculum. That's really what it's going to take. And current doctors, it might mean adding another CME requirement for them, but we would have to see exactly, what is it that we want current physicians to know and to be aware of. But in terms of medical students, we would need to add that across the curriculum for every student to be trained in that. That's the only way that's going to work. But I think that as an entire society, I think all the disciplines, I think what we have found is we had a pandemic, which we should have been prepared for, but we weren't prepared for. We weren't prepared for what would happen if a pandemic happened. Meaning, what would happen economically? What would we have to respond to? What would happen health-wise? How would we need to respond? What would we do with education? We had absolutely no plan for this kind of crisis, and yet, we've watched this kind of crisis in movies for decades, as if it really wasn't a potential. And even as dire as COVID is, it could really be worse. It could be like the plague in the 1800s and the early 1900s. We have something that we actually can still live around. We have something where we have found that people have innate immunity to COVID. So we have something that allows us to still function. But we didn't have, even around the world, where we had these brains really thinking about what would really happen and how does everyone need to operate. Well, one of the things that I'll say that COVID really has done, it has accelerated technology by 10 years. And what I mean is the fact that we are now embracing telehealth at the level in the healthcare industry that we have. That would not have happened. Telehealth has been around for a long time. It is nothing new, but it has so much regulation around it. And it had, really just, regular patients not wanting to and embracing the use of that. And then we had the education system where you had teachers and professors and the administration who did not want to integrate technology at a high level that it is now into the practice. And so now what we have is this acceleration of technology in our life. And then how are we going to now really use it, right? Now that we have been forced to embrace it, how can we now use technology to really improve health outcomes? And how can we use education to really teach and train much more effectively and efficiently to individuals actual levels of learning? Those are our new challenges.
Thank you very much. That was, I enjoyed that, and I think you hit a number of wonderful areas that everyone can use. This is going to be a panel question. This is to the panel, and this is going to be our last question, and that is, what are some leadership rules that you as managers need to use or have used, or what are leadership rules that managers must use during times of crisis such as this pandemic? And in a way, Denise, I think you hit some of those already, but go ahead, and I'm just opening it up to the entire panel. Deepa, General Dingle, just to say a few that you think are important during this time, during crisis times.
As leaders, communication comes forefront in all this. We are in a new world. Again, I go back to doing business without a handshake. Everything is virtual. So constant over-communicate. Also, make sure you're telling your people, what are we doing? Why are we doing it? and how are we doing it? Getting feedback from your team constantly is also important, because when you're in a room, it's easier to get involved. People can raise their hand, they can talk in between. But now it's a virtual world. The more you reach out to them, there are several tools where you can get feedback, where you can ask them for opinions. Just in Boston Scientific, we've had multiple town halls. The biggest question we've had is, how are we going to work from home? Is this going to be permanent? People are anxious about it. So we sent out a questionnaire for our people, asking them, what do you prefer? And once we were very open about it, transparent about it, and said that, okay, this is the feedback we got. This is how we're going to progress. So really involving them and finding unique ways to involve your team is going to be important. And I'm talking about from the CEO level to a manager level, whatever level you are. Involve your people and use data to drive your decisions, not just this is what I want, this is what you want, and this is the data that we have, and how we're going to implement this, and how you're going to start seeing this roll out. So I think that's just communicate, over communicate at this point.
And I'm just going to jump in and say over communicate, but you said something that's really important. You have to involve your team and ask their opinion. You don't necessarily have to do it, but you certainly should ask, and they will probably lead you to the right place. Denise, do you have a thought?
No, I was going to say the same thing about communication is key, and constantly doing it. A lot of times you want to feel like, I said it one time, didn't they get it? No, because you don't know what they were listening to. You don't know what they're experiencing. So I think that's really important. And also to, we recognize that our staff is always, your staff is always closest to the front lines. I've always known that since I was young. And that the front line actually has the best solutions to companies' challenges and their problems, and their opportunities. And so frontline people, to me, no matter what business you're in, it should be always the people that you are listening to. I've worked with a lot of major corporations, and I've worked with the CEOs of those major corporations. And I have found that the CEOs who get gritty, meaning the CEOs who go out and stock shelves, the CEOs who perform as the cashiers, learning from the customers, learning from their staff at that grit level, are the ones that are the most successful. So Walmart is the most successful retailer in the entire world. They employ second to the government jobs for people across the world. And they do that because exactly what I said, they get gritty. They get out there and they understand and know. And it's when you remove yourself so far from understanding the customers you're serving is where you lose in leadership.
Thank you very much. General Dingle, go ahead.
And then I'll just give you a few rapid fire ones. Lead by example. Professional leadership, excellence, and synergistic teamwork. As a leader, you're establishing that standard of professional excellence, but you're also building synergistic teams that work for you, who are the experts, the SMEs who are doing the job each day. Empower them. You don't need to do it. Engage. We have a saying that in the military that we got to prevent the mushroom cloud. There's going to be things that happen. There's going to be detonating points that go off. Well, we want to get and solve and put the fire out before the mushroom and the damage goes out. So that means engaging as leaders at every opportunity. Relationships matter. Those at the strategic level, up and out, as well as relationships down and in. Know your people, know your teams. Get out, walk around, understand what the issues are within the organizations. Communication, we've hit that to a tremendous manner. Communication is very important. Remember that communication is not just down and in, but it's up and out. As the strategic leaders, you are the face and the voice and the vision. As the managers, likewise, you're representing the vision, the strategy, the intent, and the purpose of the organization, as well as the pulse in getting those issues back up. And then as women of color, you know, again, and all of us, regardless, mentors are important as you're going through. Excellence is the standard. Hurdles are expected. Nobody says it's going to be easy, but don't let those hurdles defeat you. And then finally, acronym that I use for myself is bearing, B-E-A-R-I-N-G, a small bearing. You know, we can't lose our bearing, our direction, our azimuth. You know, the B is believe in your training, believe in your excellence, believe in God. The E is endure tough times to get through it, to address the problems. The A is accept the responsibility as the managers and leaders that you are. The R is remain unconquered. You don't quit because you run into that obstacle or that hurdle. I is identify with others that are excelling. Look at the people on the screen. Mentors are important. You must establish and identify with those mentors and leaders, and it's never quit. And G is give to others. We have a responsibility to mentor our teams, to coach our team, to ensure they have what they need to perform their jobs and their duties.
Thank you very much, General Dingle. First of all, I want to say to this panel, Deepa, Denise Pines, General Dingle, this has been a terrific panel, an outstanding panel, and I thank you very much for that. And I'll just say it again, a terrific panel, because I think we covered a lot of important information, and we did it with both academic excellence, but we also did it with with an emotional quotient that makes me feel very good, because obviously you care about people. So as I close this panel out, let me make these few thoughts. The panelists gave us their thoughts, their expertise, and their opinions, and I appreciate that, and that is what has made it excellent. It is clear that when preparation and opportunity come together, the synergy that it produces is nothing less than excellence. It is also clear that old ways of thinking, outdated beliefs, and myths must give way to diversity, inclusion, and truth. And because the truth is this, we all must be allowed and encouraged to participate, develop, and mature in order to produce for our planet, which is our home, global health security, and a planet that all of us can thrive. Panelists, thank you very much. It's been great being with you today. And thank you, CCG, Dr. Taborn, for making this possible.
Thank you.
Thank you.
Thank you.
And thank you, Erica Watson, as our virtual moderator, and all of the great work. The Admiral was shooting me emails to make sure that I said thanks to you personally.
Thank you, everyone. Well done, everyone. Well done. This is how family works.
Kimo Sabi.
How you doing, sir?
Doing well. What is Brandon sending? I haven't seen, I do not believe, the final touches on the FEDI annual report.
So, Camp reported out on that today. He has the changes. He sent them to Bev.
No, I'm supposed to see him before they go to Bev.
Okay, well then let me...
Thank you, because I was waiting. You said you were still looking at it. Nothing goes to her to start designing until I sign off on it.
Gotcha. Yeah, I thought that was...
Don't...
I'll follow up.
Nope.
I ain't thinking of...
Just... All right. Bye.
Goodbye.
Make him your father. 4
to say, I'm going to give an 8-year-old this type of information, and I'm going to trust that she not say anything at all. That is hard to believe.
When he was at our house, I was daddy's girl. Now that's not true.
When
I
he
am
was
my
at their
daddy's
house,
baby.
Michelle was the baby.
I am the baby, and I was the baby. As far as I remember.